Okay, so this is Zoe, and we're going to show you a little bit about her leg and what's wrong with it and some of the therapy that we do. She's a great patient, especially when she's sleepy. So this is the leg that's not working very well. If you notice, this leg moves completely, and this one generally stays straight, and it usually hangs out about up here. It's getting a little bit more flexible. And so one of the stretches we do is we pull this leg back and we hold it back and we massage this muscle. Now she actually is able to do this herself. When she gets up in the morning she does this, but she doesn't do it that often. So this helps to get more stretch and mobility out of this joint. This hip right here is completely out of socket. It's not attached to any bone. And that doesn't hurt her, but she doesn't have full mobility in this. The most important stretch that we do is I stick my little finger up in this little butt muscle right here and bend down this foot. Oh goodness, we just sneezed. And you see how much this foot bends now. Now, this definitely doesn't bend as much as it should. If you notice, this foot goes all the way back. But she can't move this joint or this joint by herself at all. She can move the hip and she can move the foot, and she actually uses this foot to scratch. But she can't move this joint or this joint by herself. So I hold this in place, and sometimes she pushes against me, which is good because she's using those muscles. And sometimes we do little stretches like this. But if you notice, if I let this go, it goes straight back, and it usually ends up right here again. But there is a lot more flexibility in this, and it is a lot easier to do this than it was. Our goal is to be able to push this back eventually all the way back to here and maybe teach her how to use these joints a little bit better. That's it.